We're live. We're good. Hello, everyone. I am Dr. Vidolls, and we're here for your plastic surgery and another live Tuesday tip. So thank you so much for joining. This is our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. So thank you so much for joining. This month we've been talking about BBLs, Brazilian butt lift, so lipo with fat transfer to the buttock and hips. This is a very popular surgery, and we had discussed the safety of it in the first week of October. So I talked a lot about the anatomy, the ultrasound. So if you guys want to check that video out, that's in my platform. The following week we talked a little bit about tips. So that was a great live that I went over, like the BBL, how to sleep, how to position yourself, and all the really tips that I've heard from patients that I've help them a lot in their recovery. And today we're going to dive into myths and facts. This is a surgery that became so popular in social media and everywhere that everybody has an opinion about it. And there are a lot of things that are not true. So I went into Google and I put BBL myths, and this is what came up. So I'm going to go over each and every one of this, and I'll discuss if it's really a myth or if it's a fact. So let's start with the first one. This is the most, I hear it all the time. It's like, why people do that surgery? It looks so fake. It does not look natural. And a lot of people are walking out there botched. So is it really that way? No, I say this is a myth. There are a lot of BBLs out there that look fake, unfortunately, but that's why you have to search for a surgeon that meets your goals. So when you're doing this surgery, there's a lot of about the artistry and the surgeon's input in the procedure, and it's a lot also in your foundation. So if you want to make everyone a certain width of hips, that's not going to match everyone because your torso, your legs are not the same. So you have to go to a surgeon, you have to evaluate their before and afters and see what matches your goals. My goal is to always keep you proportionate. I'm not gonna just add fat to make it a bigger butt and a bigger hip without matching the rest of your body. So I think that's the most important part. So research your surgeon, see their before and afters, and go to someone that matches your goals. And the feel part, that's only at the beginning. Remember, we're transferring fat. We're not putting implants. We're not putting silicone or what they call out there biopolymers or anything that is unnatural. I am transferring your own fat. So yes, at the beginning it's going to be swollen, it's going to feel hard, you may feel some lumps and bumps, but after that fat takes, everything will feel normal and they will jiggle. So you may see these videos in social media. Yes, it's your fat, so it's going to behave like your fat, okay? So this is a complete myth. Let's go to the second one. You can't get it if you're thin. Well, there's some facts about this, okay? I'm going to say there is a BMI range because I have to harvest the fat from somewhere. So if you're very thin and you don't have any fat, then yeah, you're not really a candidate for a BBL. I have to have fat to get from the abdomen, from the back, liposculpture your torso, and then transfer it. So a BMI lower limit really in the 20 range, okay? A normal BMI goes up to 18, but an 18, 19 BMI is a very thin person. You barely have any fat. So 20, and my max BMI is 33.5 due to risk reduction things. So if your BMI is higher than 33.5, then we end up having risk of infection, wound healing problems, fat necrosis. So that is, and blood clots, which is thrombosis in the veins in your lower legs that can travel to your lungs and that can be very dangerous. So I don't recommend if you're higher than 33.5. What's really the ideal BMI? That depends on everyone, but I would say the best results are between 25 to 27. That would be the ideal BMI. So we have some fat to work with, but then you're healthy and you're fit and we can get a better result with it, okay? Let's go to the third one. You shouldn't sit on your buttock after the surgery. There is some truth about that, so that is a fact, okay? And that is for 6 weeks. It's not forever, relax. It's not that you can't sit forever. No, it's only for 6 weeks. So when I move the fat from one area of the body to the other, that fat in the new position needs to grow new blood vessels to try to get nutrients and survive. So that period of time is roughly around 6 weeks. So those first 6 weeks, we don't want to put pressure, because pressure, like sitting on your buttock, can kill that fat cells that we transferred. After the 6 weeks, those new blood vessels are in, so it's just like sitting now, right? Like we usually sit in fat and the fat doesn't die because it has blood vessels in it. So we need to wait that period of time. After the 6 weeks, you get new blood vessels, you can sit, and it will feel weird, okay? Those first few times that you sit, the buttock is gonna feel, the sensation is gonna feel off, you're gonna feel sore, but it will go back to normal, don't worry, okay? So no exercise. Well, that's a myth, really. Because it's really, again, for 6 weeks, but then you should exercise. And the exercise should be focused on weight training. You want that buttock muscle, the gluteus muscle, to strengthen up so you can have a good foundation for the fat, so you can get a better shape for longer time. If you don't work out, the skin is not going to support that fat transfer, and you may see some sagging and some stretching of the skin. So you want that muscle to support the fat that was transferred. So I do recommend exercising after 6 weeks and focus on weight training, okay? Not cardio. Cardio burns fat in the majority of times, so you shouldn't do workouts that are focused only on cardio. Doesn't mean that you are not going to do cardio for the rest of your life. That is not true. But when you're doing your exercise routine, try to focus, minimize the cardio portion of it, and increase the weight training so you can build muscle, okay? Recovery is painful. This does not have to be true, okay? It is a surgery, so it is going to be uncomfortable, okay? I can't promise a zero pain throughout your recovery, no. But it doesn't have to be torture, okay? I'm going to give you pain medications. We're going to work on massages. Massages are really helpful to get all the edema and swelling out. People really feel a lot better after the massages. I know the first few days is going to feel uncomfortable, of course, but that's why you have your pain medications. You have a pain regimen that it's a combined approach in different pain medications to keep you controlled pain throughout that first week. It's really that first 1 to 2 weeks. After that initial period of time, the pain is very well controlled. You are going to feel some sensation changes in the skin. Pins and needles, itching, that kind of stuff, because the nerve endings are growing and healing back. So that period of time is really the first 6 weeks. After 6 weeks, you feel a lot back to normal. A little bit of, when you're stretching, you may feel like a little pulling, but that will go back to normal. After 6 months, most people feel back to normal, okay? BBL goes away with time. No, this is a myth. So we are, again, right? We are transferring your fat. It's your own tissue. So yes, it will age with you. So with aging, we get some skin sagging, we get some droopiness, and that's just normal aging. It's not that your BBL caused you to droop the buttock, or your BBL caused the skin to stretch. No, it's just a normal aging. That's why the maintenance after the BBL is so important. And that involves a healthy diet, healthy lifestyle, healthy choices, exercising, weight training. All of those things are gonna maintain your results for the long run. It is not permanent in time. It's permanent. The fat that we transfer is permanently there, but you are gonna experience aging changes like your fat will experience in any other part of your body. So it does not go away with time. If you lose weight, yes, the fat will shrink, okay? So patients that are in semaglutide, GLP-1 drugs, or losing weight naturally or after bariatric procedures may see changes in the amount of fat in the buttock after a BBL. Of course, you're losing weight, the fat will shrink, but it's not going away. If you gain weight after, it'll come back. What I've seen in all of my patients that have lost weight after BBL is your shape remains. So your overall hourglass will still be there. It's just gonna be smaller because you lost the weight, okay? So I always recommend to be in your ideal body weight when you go through this surgery to maintain your results long term. But if you want to lose weight, losing 10, 15 pounds is not going to dramatically or drastically change your results. But more than that, you will see a difference. And the difference is going to be in volume and also in skin elasticity. When we lose weight, if the skin doesn't shrink with your weight loss, you may see some sagging, okay? Things to consider if you're interested in losing weight after a BBL. And the last but not least, only for the rich and famous. And this is something that I hear about any plastic surgery procedure. It's like, I'm not rich, I can't do that. Well, this is a complete myth. Majority, I would say, vast majority of my patients are normal working human beings, okay? A teacher, a nurse, a day-to-day stay-at-home mom. So you have, yes, it is a financial endeavor, right? You plan ahead of time. You also, there are finance options that we have, and you can kind of go with your goal and plan ahead, okay? And like I said, the majority of my patients are not the rich and famous. They do get a lot of surgeries. Of course they do. Everybody does. But it is not something that it's unaffordable for the regular person, okay? So this is definitely a myth, okay? I'll get some questions now.
Okay. If I only put fat in the hip dips with the tummy tuck, will it go away with time?
So it is the same concept as the BBL. It's the hip area. It's an area that fat survival, it's harder. Why? When we're fat transferring to the butt has the muscle there, and there's a better good supply in that subcutaneous space than in the hip dips. The hip dips is skin, subcu, and fascia, tendons, is not a very well vascularized portion. So when we're transferring fat, we want an area that has good blood supply so the fat survives. So that's why we say that the hip dips is not an area that takes the fat as well as the buttock. But after that 6-week period, if the fat survived in that area, then that's it, right? That fat survived and it's there. So it's not gonna go away unless you have fluctuations in your weight. So if it's after 6 weeks and the fat survived, then you're good to go.
How to avoid fibrosis?
Very good question. So fibrosis is basically scar tissue that forms in the areas of liposuction. How do you feel it? It's lumps, bumps, irregularities in the skin. How to avoid it? One, in surgery. So the surgery itself, the liposuction, I do it under low suction, less trauma to the fat, to the tissues. I try to make it as even as possible, leaving the same thickness of fat in the subcutaneous space that helps to try to avoid fibrosis. When you over remove the fat, the risk of fibrosis is more, okay? So all of that is intra-op, but afterwards, it is the most important part to try to minimize risk of fibrosis is your massages and the compression. So massages, you're gonna start the next day and the first week every day, okay? And that helps identify areas of fibrosis forming up initially, that they can be broken up, and you can avoid formation of that scarring tissue thicker and more noticeable. People that have keloids or hypertrophic scars are more prone to it, but the massages are going to be key to try to prevent that.
Do you do liposuction on the arms as well?
Yeah, that is a very common area that I do liposuction, and very commonly combined with a BBL or a mommy makeover. It's a tiny incision here near the elbow and basically emptying all this area out. I sometimes recommend adding what's called body tight. It's radio frequency energy for skin tightening, because the arms is an area that the skin is very thin and it doesn't retract very well. So depends on the level or the degree of skin elasticity. I would recommend adding that as well. Okay, awesome, you guys. Thank you so much. I hope this helped kind of understand a little bit better about the myths and the bad publicity that sometimes the BBL has. And the number one myth, biggest, I didn't mention it here because I had mentioned it in my prior life about BBLs, is that it's dangerous and that you shouldn't do it because you're going to die if you do it. But it's not true. You should go to a board certified plastic surgeon that has experience in BBLs and that uses ultrasound for fat transfer. If all of those things are met and that works in an accredited facility that prioritizes safety, like here at Pure, that we're JCO or the Joint Commission approved and certified. So all of those things make this procedure as safe as any other plastic surgery procedure like the tummy tuck, okay? So thank you so much for joining.
One more question. Sorry, one person popped up.
Okay.
Can you combine a tummy tuck with a BBL?
I don't combine these two surgeries. The reason for the reason why I don't is two main reasons. One is safety. I think that the amount of surgery, the length of procedure, and the amount of fat and fat transfer and skin removal is too much to tolerate on one. Then we increase risk of having complications after the procedure. And number two is the recovery. So I want to optimize the results on each of the procedures. So optimizing the results means that for a tummy tuck, I'm going to be asking you to sleep on your back with the knees flexed to try to avoid stretching the areas of the incisions on the tummy tuck. In the BBL, I ask you the complete opposite, to sleep in your belly, to try to avoid pressure on the buttock, to be bent over. So the recoveries are complete opposites. So if we combine those, I believe as a surgeon and in my experience, you can obtain the best results on both surgeries. Okay, awesome. Thank you for that question, because that's a very good myth about the BBL, that people are just like, I just want to do one surgery and get it done with. So I know that that's what we think, but remember, this is a surgery that's going to transform your life, and it's better to do it right the first time and not trying to then correct things that may happen after combining those two procedures. Okay, thank you so much. I'll see you guys next week of Tuesday Tips. Take care.